Do you have Achilles tendon pain and you've been dealing with it for a long while and it just wouldn't go away? Well, stay tuned and I'll tell you how to fix it. Well, for starters, before we get into how to even fix it, let's talk about the anatomy, what the Achilles tendon is, and all of that stuff. So the Achilles tendon is the strongest tendon that we have in the body, and it's located behind our heel. And it's that thick band that you feel right there when you touch along the back of your heel. It is formed by two muscle groups, the gastrocnemius muscle and the soleus muscle, and it attaches to the back of the heel bone. Usually a lot of people don't really pay much attention to it till it starts to hurt. Well, what is tendinitis? The itis part of it means inflammation. And so essentially what we're talking about is the Achilles tendon is inflamed. And this could come from trauma, maybe a fall, you trip and you sprain your ankle or anything like that. It could come from overuse injury. You're an athlete, you're army, or you're in the army or in the military and you've just been using it and now it's just it's rebelling a little bit and it's like, no, stop it, give me a break. It could just come from a number of things. Actually, some antibiotics too could actually cause there to be inflammation in the back of the heel. So there are various causes to why you have inflammation or pain in your Achilles tendon. Well, this video here, we're trying to figure out how to get rid of that pain, at least from home in the beginning stages of it. What are the symptoms that you will have if you do have Achilles tendinitis? If you're not sure if that's what you have, well, one of the things that you'd have is you'd have pain with walking. Now, the function of the Achilles tendon is to help us propel. It's to help us push off when we're walking. It also helps to kind of raise the heel when we're walking. So sometimes when you're walking, you may find that you have pain in that instance when you go to move. And some of the symptoms you have is mouth discomfort, stiffening, just aches and pains right around that area. Sometimes if you run your fingers along the Achilles tendon, you may actually feel the area where you're having the discomfort or the inflammation. There are two types of Achilles tendinitis. There is the insertional Achilles tendinitis, which means inflammation of the Achilles tendon right in the area where the Achilles attaches to the bone. And the other one is the non-insertional Achilles tendinitis. That is within the body of the tendon. So that's not close to where the tendon attaches to the bone. It's a little further up. Well, what's the difference? With the insertional, sometimes you may have some swelling around that area because of the retrocalcaneal bursa that's there. So it may have some swelling. When you go to walk first step in the morning, you have stiffness and pain and things of that nature. Well, the non-insertional, you don't really have that swelling that goes up and down. If there's swelling there, it just stays because at that time we have hypertrophy or swelling of the Achilles tendon and just scar tissue formation. So it doesn't really go up and down, up and down, up and down. But the insertional one does, mostly because of the bursa that's around that area. Fills up with fluid when you're inflamed, and when you're feeling better, when you've iced it, when you've rested it for about a week or two, the swelling comes down, and then you go to exercise, and bam, it swells up again. So that's usually the main difference. So now we have Achilles tendinitis. What can we do? What are the treatment options that we have? Well, you have massages that you can do, and I will put a little video or description of some of the massages that you can do. Essentially, you just want to kind of rub the area and disperse that scar tissue, okay? Because then you can kind of increase with the massage, it causes heat to form in that area, which will kind of help blood flow come to the area as well. Now, one thing you also need to know is that the Achilles tendon is not the most vascular structure. What that means is it doesn't have a lot of blood flow that comes to it. A lot of the blood flow comes from the muscle up top that supplies the top part of the tendon and then the bone where the tendon inserts. So, well, what happens to the middle part of the tendon? So that area is usually a lot of the times, like we talked about, where the non-insertional tendinitis comes through because you don't have a lot of blood flow to help bring the inflammatory factors that help to heal it when it's inflamed. And so you do have a lot of tendinitis there. So what you can do is you massage that area really nicely. If you can feel a bulge, just massage it as much as you can. Now, if you've been a weekend warrior and you just went out to go work out after you haven't worked out in ages, that's usually a lot of the reasons why you would have inflammation in that tendon as well. Your Achilles is like, hold up, wait a minute, we haven't worked out. So what you can do in that situation is the RICE therapy, and that is rest, ice, compress, and elevate. Those are absolutely essential in the acute injury to the Achilles tendon. So you want to rest it as much as possible. Get ice, an ice pack, a bag of frozen peas or something, wrap it around a cloth and put it right behind your Achilles tendon. Compress it. Get an ace bandage. You can get it from Walgreens, Walmart, CVS, or any of the drugstores, and elevate it as much as possible. That will help with the inflammation, it'll help with swelling, it'll help with pain, and it'll help with discomfort. So those are things that you can do at home as well. Also, another thing that you can also do is take an anti-inflammatory medication. So like ibuprofen, Aleve, or one of those will definitely help as well. Make sure that you are not allergic to these medications. Make sure that you don't have any gastric or duodenal or intestinal ulcers or anything like that. And make sure that they don't interact with any of your medicines. So if you're taking a lot of medication, call your primary care physician, call your foot doctor, call your family practice physician, and ask them if it's okay for you to take all these, any of the anti-inflammatory over-the-counter medication. Also, if you have kidney issues, you want to make sure that you check to see if your doctor is okay with you taking these medications. Another thing that you can do is a heel lift. You can purchase these heel lifts online and you put them in your shoe, and they will really help with kind of easing the pain in that Achilles tendon. For treatment options, we also want to find out what's causing this. Is it activity? Is it just the way that your foot is created or your foot is made, or how you walk? Or is it just, something that happened? Was it acute trauma that happened? If it is activity, of course, we want to say activity modification. So you may need to reduce the frequency or the intensity at which you do a certain exercise, or maybe do non-weight bearing exercises or swimming or things like that. Things that will not put pressure within the Achilles tendon. So those are some of the things that you could definitely do. And there are other things that, your doctor, your podiatrist, your foot doctor, your orthopedist will help you figure out to see which sort of activity modification will be best for you. Does it matter with treatment? Not really. And I will have a special guest that's going to come on here and actually teach us how to do exercises at home that'll really, really help eradicate this pain. I'm so excited for that. So please stay tuned, subscribe, hit the notification bell so that when the special guest comes on, you'll be the first to see it.